Thank you for joining us. Our webinar title on the journey of IMU Pharmacy Degree Credit Transfers Pathway to Australia. And it's great to have not just our Associate Professor Dinesh Kumar from IMU, who is the Program Director of Bachelor of Pharmacy from IMU, but we also have two more representatives from University of Tasmania who will be sharing with you a little bit about University of Tasmania Pharmacy Program. So we have Professor Glenn Jacobson, who is the Head of School of Pharmacy and Pharmacology at the University of Tasmania, Australia. And of course, we have Ray as well, and who is the Marketing Representative in Malaysia. All right. Before we go to start this webinar, I just want to remind all of you a few things. All right. We are muted all your microphone. Okay. So if you have any questions and if you have any things that you like to find out from the speakers, please put in your questions or comment into the Q&A chat box. All right, we will be able to answer all your questions at the end of the presentation. And of course, just to let you know, the webinar will be recorded. All right. In this webinar, we're going to start by a very short presentation from Associate Professor Dr. Dinesh, talking a little bit about our IMU Pharmacy program. All right. And then following by that, you'll be listening from Professor Glenn Jacobson and also Ray about University of Tasmania Pharmacy program. All right, Dinesh, are you ready?
Yes, I'm ready. Thank you, Dr. Wong.
Passing to you.
All right, a very good evening to all of you who have made time to come for this webinar. So I'm glad that you all are here. So I'm just going to give, like how Dr. Wong mentioned, I'm just going to give you a brief introduction about the pharmacy program at IMU. So before we move on, so what exactly comes to your mind when you think of a pharmacist? So basically, what we have, the perception is that the pharmacists are medication experts who prepare and dispense prescriptions. They ensure medicines and doses are correct. They prevent harmful drug interactions and counsel patients on the safe and appropriate use of their medications. Today, we see that pharmacists also work in drug industries, in armed forces, in government bodies, and in educational sectors. So this is contrary to the belief that sometimes we think that a pharmacist means they only work in hospitals and in community pharmacies, but apart from that, today they have the job scope has widened tremendously, and they work in many sectors. So moving on, so I probably guess many of you are at this particular level where you would have probably finished your SPM or say O levels, and you have many options in front of you. Either you can take a foundation program, or you can go in for an A-level program, or you also can have options like diploma matriculation, Australian matriculation, and STPM. So you have many options in front of you. So ideally, what we think over the years is that the university foundation program is an ideal pathway to enter into professional programs in many of the universities, including IMU. So if, say, for example, you took the IMU University Foundation program, then you have a very easy path to enter into the pharmacy program, especially I'm talking from the angle of IMU. So the ideal entry requirements are provided here. So if you see that in SPM, generally for entry into the pharmacy program, you need a pass with 5 Bs in SPM or IGCSE. Then when you have this, you move on to, you do your foundation in science. In foundation, if you have a CGPA of 3 and above, automatically you become eligible into the pharmacy program. So this is about the entry requirements. So having said that, the entry requirements through other pathways, for example, if you have done STPM or say at another degree program or matriculation, or you will have information about the entry pathway if you can go into our IMU website, which is www.imu.edu.my. You will have all the details there. So coming on to the IMU Bachelor of Pharmacy program. So this particular program was launched in the year 2004. So the Bachelor of Pharmacy program at IMU is actually for 4-year program. We have 8 semesters and we have 2 intakes, one in July, another one in September. So we have 2 intakes. And the pharmacy program in IMU actually is accredited by the MQA, which is the Malaysian Qualification Agency, and also the Pharmacy Board of Malaysia. So it's a recognized and accredited program. So this is the job opportunity or the scope of the BPharm program. Many of, like what I mentioned to earlier, many of general public think, okay, having a pharmacy degree or a BPharm degree only lead to work as a pharmacist in a hospital or a clinical setup, or in a community pharmacy like Guardian, or in a caring pharmacy. But apart from that, contrary to that belief, we have several pathways, as you see in this particular slide. The job scope for a pharmacist actually has been widening, and you see that we have now today pharmacists can also work in, say, academics. They can continue their studies. For example, after completing BPharm, they can go on to do a master program, or even go on to do a doctoral program and become a university lecturer, or and they also enter into regulatory affair fields or clinical research, and also industry, especially the industries where they manufacture medicines. Yeah, so they can go into many like what you see here on the industry, production sector, or research and development sector, or quality assurance, quality control. So all these fields, what you see here, we need pharmacists. So the job scope of pharmacists is not just confined to be a pharmacist, but is quite wide range, as you see in this particular slide. So having said that, we have if you also, I would like to highlight that, say, for example, after doing the BPharm program, it is mandatory that graduates should undergo a 1-year training. We call this as the pre-registration training. So after going through that 1-year training, then another 1 year as a compulsory service with either a government sector or a government recognized private sector. So basically 4 years of BPharm program followed by 1 year of pre-registration training and followed by 1 year compulsory service. Then eventually become a fully registered pharmacist, or what we call a licensed pharmacist in Malaysia. So another pathway is that, instead of doing all the 4 years in IMU locally, students have the option of doing a credit transfer path. So what they can do is that they do 2 years in IMU, and then they can do the remaining 2 years in one of our partner institutions. Now here is I have portrayed the University of Tasmania. So this credit transfer option in the past years we have many students who have been opting for this particular credit transfer option, and this is one of our highlights of the IMU BPharm program. So the highlight is that, or the benefits of this pathway is that students can work in Australia, and even if they want to come over back after completing their 4 years, if they want to return back to Malaysia, that's also possible. And another benefit is that students who take this credit transfer option, they get an Australian degree. So these are some of the benefits of the credit transfer option which we have with the University of Tasmania. So this is something about what we have, the highlights of the pharmacy program at IMU. So with that, I conclude my brief introduction about the pharmacy program. So now I would like to pass it over to Dr. Wong.
Yeah, thank you, Dr. Dinesh. Yeah, I'm sure a lot of you who join us today because you are very interested, or you might be considering to pursue a pharmacy degree, perhaps in Australia. And of course, today we have with us Professor Glenn Jacobson, who is the head of School of Pharmacy and Pharmacology from University of Tasmania, Australia. And we have also Ray, who is the Tasmania University's marketing representative in Malaysia. So they are going to be explaining and, of course, describing and telling you a little bit more about the pharmacy program that you might have, interest in the University of Tasmania. Yeah, Ray, would you like to share your slide? And all right, okay, I hand it to you, Prof. Glenn.
Thank you. So it's great to be here, and great to have the opportunity to talk about the articulation pathway and the opportunity for IMU students to come and study with us and complete a Bachelor of Pharmacy with honours at UTAS and practice in Australia. So, just a little bit of background about me. I'm a pharmacologist. I'm head of the School of Pharmacy. I do a lot of work in beta-2 agonists, which are drugs used to treat asthma and COPD. And I'm also work in research areas associated with drug analysis and also sports doping and applications of drug analysis to test drugs and performance-enhancing drugs in athletes. So this is just a picture of Hobart, the Port of Hobart. And within that shot, you can see the Royal Hobart Hospital, which is a new, had a new wing built on it recently and opened and commissioned, which is located next to the Medical Science Precinct, where some of our teaching is undertaken. And that's the building, if my cursor works, just over here in the city. Just back from here down, really quite in the foreground that you can't really see, is actually the University Sandy Bay campus. Now, there's a lot of our students will work in the city, certainly working in the health fields. A lot of the College of Health and Medicine, of which we're a part, are actually located, those students are located and study in the city. Our campus is actually at Sandy Bay, just in the foreground, just in front of the marina with all the boats in it. So next slide, please, Ray. So a little bit about Tasmania. We're Australia's southernmost state. We have a distinct temperate climate with distinct seasons. It's wintertime there at the moment. When I left for Malaysia, it was around 10 degrees Celsius maximum for that week. It was a bit cold, certainly compared to here. But we have clear seasons. We've got quite warm summers and mild, relatively mild winters and autumns and spring, and quite pleasing spring weather as well. We've got a small population, around 250,000 all up in Tasmania, probably a bit over 200,000 in Hobart. And we're pretty well connected to the mainland, which we call the main island of Australia. We call it the mainland. So getting flights to Melbourne and Sydney, larger population centres, is relatively straightforward, or very straightforward, I should say. Regular flights, multiple flights every day. So it is easy to connect to the major cities on the mainland. We're an island state. We have a stunning natural landscape. A lot of the land is World Heritage Wilderness areas, and it's in close proximity to our campuses. And we've recently been doing a lot of work in sustainability, and we're actually powered 100% by renewable energy in Tasmania. And we're actually recent rankings, QS rankings for sustainability and climate action, right at the top internationally in terms of universities making a difference. So we're the only university in the state, and that allows us to have strong ties with the Tasmanian government and industry. So from our perspective, that really means the Tasmanian Health Service, who look after the public hospitals, public teaching hospitals. So we've got strong links there, where a lot of our graduates will end up working, and community. And again, in our context, that's the community pharmacists. We've got close links with the various professional organisations, and that provides great opportunities for work integrated learning. So most of our students will end up working in one of those fields, either in community or hospital pharmacy, though there are emerging fields in aged care and other industries. But what that does, we've got a really strong relationship with our professional bodies. They sit on our course advisory committees, which are committees to ensure that we're on the right track in terms of meeting industry needs for pharmacists. so that we work very closely with them, making sure that our graduates are the best they can be and meet the needs of their future employers. As I said, we're #1 in the world for climate action, and we're an old university. We're actually the 4th oldest university in Australia. And another note, we have small class sizes, high quality practical teaching, applying theory to real world situations, and we really desire to build strong work-ready skills in our graduates. We see that with placement hours, for example, where all students receive over 400 hours of placement, professional experience placement in either community hospital settings, as well as newer areas where our graduates end up working consultant pharmacy in aged care settings, for example. So we've got small class sizes and we'd like to think a very high quality program, and our graduates are well received by employers and sought after, in fact. Okay, next slide, please, Ray. So what do pharmacists do? Again, quite similar to here in Malaysia, probably not as much industry, pharmaceutical industry work in Australia. Most of our most of our pharmacists, sorry, I think we skipped a slide. Yeah, thank you. Work in, as I said, in community hospital pharmacy, and really improve health outcomes in patients through applying expertise in the use of medication. So a very strong clinical focus, and that clinical focus is in both the hospital and community settings. Our pharmacists ensure the supply of medicines that are of good quality, provide information on the rational use of drugs to patients and others involved in healthcare, again, to make sure that they're being used safely and to optimise patient outcomes. And there's also the opportunity for students to be involved in research, and the program itself is an honours program, so there is a research component to it, and that allows you then to develop some research skills which can then be expanded upon and do further research if that's something that you aspire to. So our pharmacy graduates provide their services in a wide and expanding range of settings, and certainly in Australia, pharmacists are the most accessible part of the Australian healthcare system. So Australian pharmacists are routinely recognised in the top 2 or 3 most trusted professions because of their accessibility and trustworthiness as perceived by the community. Okay, next slide. So we're we have a wide range of job opportunities, flexible working hours, can work in multiple areas and have the opportunity to travel and work overseas. So graduating as a pharmacist in Tasmania after an intern year of supervised practice, you become eligible to practice as a pharmacist in Australia. And that professional recognition works across all states, so you can work anywhere in Australia and also quite easily in New Zealand. One of the benefits of working as a pharmacist is the flexibility. There's flexible working hours. You can work fractional roles. You can do other things, work 2 or 3 days a week and work in other parts of the healthcare system, or do other things that don't involve work. So there's a lot of flexibility, and that's really, really well valued by a lot of our graduates. If you don't choose to work full time, or you want to change settings, some of our pharmacists, for example, will start off in community and then they'll move to a job in the hospital environment, and vice versa, moving back the other way. So there's a lot of fluidity between careers. So when you graduate with us, it's not as if you do an internship in the hospital and then you're committed to the hospital for the rest of your career. It's not like that at all. There's a lot of movement between hospital and community, and now aged care settings as well. Okay. Last thing on that slide, sorry, Ray, if I just say there's an increasing awareness of what pharmacists can do in Australia and really pushing scope of practice. And really there are a lot of emerging areas, that professional practice areas that pharmacists can contribute to. Pharmacists were heavily involved in the COVID vaccination rollout, but there are expanding services in chronic disease management, prescribing for urinary tract infections, for uncomplicated urinary tract infections is another area that's expanding for pharmacists. A whole range of opportunities that are really pushing the boundaries of what pharmacists can do, which is great for pharmacists, great for career development, and it's great for the public, the healthcare system, because pharmacists can do a lot and alleviate a lot of the burden of parts of the healthcare system, where a lot of the healthcare system in Australia is stretched. We don't have enough doctors, nurses, pharmacists, and so things pharmacists can do that they are capable of and within their scope of practice relieves pressure on other sectors of the healthcare system. So very much expanding scopes of practice, new opportunities, new things to do to really make a difference, and it's quite an exciting career to be in at the moment. Okay. So highlights of our degree, we're actually now teaching across 3 locations in Hobart, Launceston and Burnie, but most of our students, certainly international students, choose to study in Hobart. Our program offers over 440 hours of professional experience placements for IMU students, or all our students in fact. So that's in community, hospital settings and aged care consultant pharmacy, so you get some experience there. Also vaccination and medicine review accreditation training courses are involved in the program, and also research projects as part of the honours program. The Bachelor of Pharmacy with Honours is recognised Australia-wide. As I said, many students choose to undertake an intern program in Tasmania or in other states. But again, once you graduate, you can move freely within and take up an intern position in another state of Australia, or do it in Tasmania and then become registered and then move interstate. We have 100% employment success for our graduates. All of our graduates in recent years have got jobs. For those that choose to remain in the profession, I should say, many of them decide to stay and work in Australia. Getting a job is not hard. We're well regarded by potential employers, and all our graduates end up getting jobs. Okay, so the Bachelor of Pharmacy is now a 400 credit point trimester program. So what that means is for students that start with us from year one, do a lot more. They have a trimester, so 3 semesters per year, and so do a lot more work. So what that means with the articulation with IMU is that instead of articulating into year 3 of a 4-year program, you articulate into year 2 of a 3-year program. So there's still only 2 years of study. So that means then there's starting in with a transition unit in January, working over the break of at the end of your first year with us, and then into second year, and so essentially your final year of the program, and then graduating in December. The break over the December-January period, even though it is a trimester, it is a teaching period. We do schedule our teaching such that there's around 4 weeks of non-contact time in January, so that there is the opportunity to travel back to friends and family over that Christmas, New Year period as well, if students choose to do that. And that's a change for this coming year, which is good. Okay, next slide, please. as I said, coming into the program, there's a transition to pharmacy practice unit at CSA 307. It's a bridging unit that enables us to upskill students with the Australian healthcare system, what it's like, contextualise it for what it's like to be a pharmacist in Australia. So bringing students up to speed with pharmacy practice in Australia and the Australian healthcare system, because things are different, different environments, different tools, different healthcare system, different funding mechanisms, etc. So there's just a few things that we work through in that bridging unit to make sure that you're set up for success in your first year with us. Okay, next slide, please, Ray. So you can see this transition to pharmacy practice. You can start that online here in Malaysia. And then the face-to-face component of that is an intense period just before you actually start the normal year 2, or in your case, year 3 of the bachelor program when you arrive on campus. So there's 7 weeks of teaching essentially, 6 of which is online. The last week is the face-to-face actually with us in Tasmania. Okay. So in terms of enrolling in CSA 307, the unit, the transition unit, you must have completed years 1 and 2 of the Bachelor of Pharmacy at IMU. There's some IELTS. You are exempt from completing IELTS for enrolment. The cost of the bridging course is around $4,000 Australian, and there's also a letter of offer as well that you should automatically be enrolled in CSA 307 once you've received that, accepted that. Okay. Okay, next slide, right, thank you. So as I said, strong employment prospects. 100% of our graduates in recent years have found employment within 4 months. So no shortage of jobs out there, good jobs. Pharmacists, as I said, are in high demand. There's workforce shortages for pharmacists, both in the hospital, community and aged care settings. So there's no shortage of jobs. UTAS pharmacy graduates are highly regarded nationally. We're well respected. We're a long-established school, and our graduates represent us well, are highly regarded. All students have professional experience placements in both community and hospital pharmacy. And again, you're not sort of necessarily constrained to one of those paths to the program. There's opportunity to move between them. And we see a lot of our graduates do that between hospital and community and vice versa. We've got a long history of innovation in pharmacy education, a strong track record in medicine safety research. And we're one of the top study areas of UTAS for student satisfaction, with students reporting smaller class sizes, high standards for assessment, content and structure. So we've got a good course that we're very proud of, and is well received by our pharmacy community. Okay. Ray, do you want to? Actually, sorry, this is my one. So completing the Bachelor of Pharmacy with honours, as I mentioned. Please try again. Sorry, that's Siri. Once you complete the Bachelor of Pharmacy with honours, there is 1 year of internship that you do either in a hospital or community setting with your preceptor, and then there's a registration examination, and then you're a registered pharmacist. And at that point, then you become registered by AHPRA, which is our health practitioner body, and you can move freely and practice freely within Australia once you have that registration. Okay. I think this is an interesting slide because it's the indicative salary comparison for highest median graduate incomes across all UTAS graduates 5 years after completion. It's actually based on some old data, but we've indexed it moving forward to 2024 figures. And as you can see, pharmacy graduates, the median graduate salary is the third highest of all graduates from the University of Tasmania, behind medicine, behind engineering, but ahead of law and paralegal studies and business management. So that's a really good outcome, return on your time studying with us. And the salaries are around $100,000 Australian. And we've got a lot of employers that hire our recent graduates. We work with larger banner groups, smaller pharmacy chains, and the Tasmanian government, who administer the public hospital system in the state. That's a sort of summary of our program. And I might now hand over to Ray.
Yep, thank you, Glenn, for that introduction of the university program. So for all students who are transferring over from IMU to University of Tasmania, all students will automatically be assessed for any available scholarships that is being offered that year. The one that is usually being offered is called the Tasmanian International Scholarship, which is a 25% tuition fee scholarship for the whole duration of your studies with the university. So, but the condition to achieve that scholarship is that you need to achieve at least a GPA of 3.5 and above out of your 4 from your IMU studies. Then only you will be considered this scholarship. This scholarship does not have a quota to it. So as long as you have met the required GPA, you will receive it for the whole remainder years of studies with the University of Tasmania. So once we receive the confirmation of your GPA letter from IMU, then it will be stated on your offer letter from the University of Tasmania. So across the university, we do understand that, for some of you, it might be the first time coming over to an Australian university, and for most of them would be their first time into Tasmania. So it can be daunting, it can be scary a little bit, but we do have quite a wide range of support system to get you set up nicely and to be there for you to support you throughout your journey with the university. So which some of them are like UniStart, which is a self-paced introduction courses for you to study. We also have on-campus student advisors who were once student at the university as well, and they are able to guide you through things like, how to arrange your class timing, how to make sure you register for your units correctly, what happens to your visa if it's going to expire soon, what do you do next. We also have 24-hour study support through our online portal. So if, let's say, you have any question and your assignment is going to be due in a week's time, we will be there to support you. There are various learning and academic skills as well. So all we ask is for students to reach out to the student advisor or peer-assisted learning session with your seniors. We will be able to help you and guide you through accordingly. So when you come through to... So when you come through to the university, obviously you will be needing a place to stay. For new commencing students, I highly recommend that you stay on our university managed accommodation. All of these accommodations are owned and managed by the university, so you can be assured that there are no outsiders. Only university students will be allowed into these buildings, and we have various security measures in there, so you won't find strangers coming into the building without letting the security know or the registration desk know, and so forth. And it is all of our accommodation are within walking distance to your classroom. Therefore, we do recommend that you stay with us for at least one semester, get your bearings around before you decide to move out, should you move out. In my experience, a lot of our international students will remain in our student accommodation until they graduate because they really do like the place very much. So here is just a snapshot of how the living room looks like in one of the Hobart apartments. So most of our accommodation is like an apartment style where they have a living room, they have a sharing kitchen and a sharing dining, but all of your rooms are single room. So as mentioned, we have safe and secure with pastoral care support from our dedicated staff. And they are generally a short walk to your classroom, be it if you choose Hobart accommodation or the Launceston accommodation. However, all rooms are allocated based on a first come, first served basis. So once you have received your university offer from us, please put in an application for accommodation through our portal as well, so that we will be able to put you on top of the waiting list once a room is available for you. So all of the price that we have listed on our website would have includes all utilities, university Wi-Fi and so forth. So a good snapshot of what the cost is like. Here is what we are looking at as of May 2024. Now, these are weekly rates. All single room, you don't share your room with anybody. Some might be a sharing apartment, while some are studio apartment pricing. But as mentioned, all utilities would be included, and you know, your water, heater, electricity, internet, all included. I had students asking me, what about air conditioning? Well, the good thing about that is that Tasmania doesn't need air conditioning, but we do need heater. So because Tasmania does experience a more temperate climate. As of now, we are going through winter time. And I think we are at slightly above 0 degrees, but let me look at the temperature now in Hobart. We are actually looking at 6 degrees at this very hour, 6 degrees. So keeping warm is much more important in Tasmania. So you don't really need air conditioning like how we do in Malaysia. Right. So in terms of student living, we have a wide range of clubs, sports community, and a lot of the student leadership networks for you to utilize and to beef up your resume before you graduate. So, you know, future readiness and leadership is one of them. We have campus sport, and they are very competitive against each other. But if you're more into the more cultural scene, we have a lot of the arts and performance events going on year round. So I've heard people saying that Tasmania state is one of the few states in Australia that has the most music festival happening all year round. So if you're into music, we are the place to be. So there are plenty of things to see and do in Tasmania. So things like we are the largest lavender farm producer in the Southern Hemisphere. You know, we have from the all of all Australia, we are the only state that has truffle production. You know, we have a lot, and if you're interested in seeing fishes like migration fishes, you can easily spot whales and dolphins and all of the migration fishes in the waters of Tasmania. But please come with an open heart and an open mind, because Tasmania is not Malaysia. And it's nowhere near what Malaysia has to offer. Tasmania will be able to provide you with a different lifestyle that you will never have, you know, you would never imagine before. We are known to have one of the cleanest air and water quality. And, you know, when you go there, things really do smell differently. And because Tasmania is a seafood export state. So a lot of the seafood food in Tasmania are very fresh and very nice. I can tell you for sure, in my 6 years of working with Tasmania, I've never tasted any fresh oyster as nice as Tasmania oyster. After coming back from Tasmania, no matter where I try fresh oyster in Malaysia, they come nowhere near to Tasmania oyster. That is a fact. Of course, that is if you're into fresh oysters. But we do have other wonderful food sceneries and food that is catered for different culture and religious background. So don't worry, you will be taken care of. And we do have a growing art scene in Tasmania that is well known worldwide. So you will be able to develop different lifestyle and hobby should you give your chance to experience it in Tasmania. So with that, that concludes my presentation together with Glenn's.
Thank you very much, Ray, and of course, Prof. Glenn. I love oyster, so you have managed to excite me now. Yeah, I hope all those of you who are joining us, I hope you're excited as me after listening to Ray's describing all the nice things, and of course, after Prof. Glenn has explained to you a little bit about the pharmacy courses. So if you have any questions, please remember to put into the Q&A box. All right. Anyway, so far we have questions regarding working in Malaysia. Basically, the question is about the SPM requirement for them to work in public sector. Dinesh, would you like to answer about it?
Yeah, sure, Dr. Wong. So to work in Malaysia, the SPM requirement is that students should have a credit in Bahasa Malaysia. So as long as students have a credit in Bahasa Malaysia there, and if they have a pharmacy degree, and once they become, registered pharmacists or licensed pharmacists, they can easily work in Malaysia. That's the only condition.
All right. Okay. Thank you very much. Prof. Glenn, I think out of the interest, because a lot of students normally would ask about registration in Australia, would you be able to elaborate a little bit, how, after finishing the course, what would the student need to do, or how long will it take for them to get the registration process to be done?
It's basically 12 months after, so there's a 12-month intern period after graduating. You would work with an intern training provider. So there's a number of courses that are available. The Pharmaceutical Society, there are also some, the Pharmacy Guild of Australia, which represents community pharmacists, offer intern training. And that then leads to you being able to sit the board exam at the end of your 1 year period. Well, it's a little bit shorter than that. You can apply to sit it, I think, once 3/4 or the majority of that intern training year has been completed, and then you can sit the board exam. And should you pass it, you'll be eligible for registration. Our students go very well, perform very well in the board exam. We don't see, we see where they sit compared to the national average, and our students routinely on a range of metrics perform very well for the board exam. And as I said, once registered, then you can practice as a pharmacist in any state of Australia.
I mean, in the presentation just now, it was mentioned that, a lot of students actually be able to get their job within basically quite quickly in that sense.
Yes.
So normally, what would be the sort of areas where the students, the graduate would go through? I mean, community and hospitals seems to be quite common, available jobs in Australia at the moment.
Yeah. Yes. So normally what would happen, and quite often, because we have a lot of placement, so students do placements with some of our placement providers. So it could be a community pharmacist, it could be in a hospital environment, and so those students will be known and become known to the to the pharmacist or the hospital team. And if a job comes up, they would obviously have some advantage there. Quite often, that's for the more competitive jobs. Sometimes jobs are just offered directly to those students that are undertaking their placements, and then they will have a position, an intern position, ready to go. There's no shortage of intern positions in Tasmania, and all our students will find a position. So that's how the job process goes. So it's really a job. The intern job process is fairly straightforward. And then after that intern year, once you're registered, you can work however you want. If you're a registered pharmacist, you can apply for jobs like normal, like any other role, but quite often, because there is such demand, it won't require much effort to apply for jobs.
Mm-hmm. Maybe Dinesh, you'd like to explain a little bit about maybe Malaysia's side as well?
In the job scope, you mean job scope, right, Dr. Wong?
The internship, basically.
Oh, internship. So internship in Malaysia now, after the era of liberalization. So previously, just want to highlight that previously, internship can be done only in government sector. For example, in a hospital or a community setup, which is generally government based. But after the liberalization, now the Ministry of Health in Malaysia have actually opened up. So as long as the place is actually recognized by the Ministry of Health, it can be a private setup as well, or even an educational setup. As long as it is recognized by the Ministry of Health and the pharmacy board, students can go and do the internship there. So in terms of that, now there's no more backlogs of graduates who is waiting for internship places. So in that way, it is more now liberalized, and it is eased up the pressure. Yeah. Thanks.
Looks like, those of you who are interested whether to stay in Malaysia or Australia, I think there is few jobs, and not to worry about it. I think the programs itself, with regards to Tasmania, some questions that normally sometimes we will ask is about the international student population. Do you have any info that you can share about, how over in Tasmania?
I think if let's say Glenn will be able to address specifically in the pharmacy school, but overall, university-wide, our total student population is about 48,000 in total, but less than 20% are international students. Now, because of the sheer volume of certain nationalities, we do see more of other international students around on campus. However, within certain schools, such as like the School of Health and Medicine, we are only accredited in specific countries. So then you don't actually feel their presence as large because, for example, we actually don't get a lot of Hong Kong students into the pharmacy school. It's because of the accreditation, but we see a lot more of the Korean students due to our recognition in that country. So that's an example in the pharmacy school. But it's less than 20% international students at the moment.
But for us in pharmacy, it's probably a little bit higher than that. I'd say probably on average 25 to 30% of our cohort would be international students. But yeah, there's quite it depends on the program, on the discipline, because some disciplines attract different cohorts of students as well. So it's quite diverse.
Mm-hmm. All right. And of course, some students might, be wondering as well whether they are allowed to actually work when they are studying. Any information that you will be able to share with us on that?
Yes. So all international students, when they enter into Australia, they will be coming in with the Australian student visa. So no matter where they are studying, with that visa, they are only allowed to work a maximum of 24 hours per week. So essentially like 3 days of full-time work kind of load, and no more than that. So yes, they are allowed to work, but only maximum 24 hours per week.
Any idea if there is any students who work over there? I mean, especially pharmacy students, or it's quite...
Pharmacists, I think generally most of our students, they do, but they hardly work up to the 24 hours maximum timing, because they will usually take like Saturdays and Sunday to work like half a day or a full Saturday, Sunday in, for example, a restaurant, cafe. There are students who work throughout the week for the university as research assistant or student advisor and things like that. So there are plenty casual job, all these are actually called casual job, available for students. And I've actually heard that if a student is interested to char kway teow, they actually earn more because they do get paid very well if they can cook a good plate of char kway teow.
Yeah. I mean, out of my curiosity, are there a lot of Malaysian restaurants there in Tasmania?
A few of them, not to say a lot where you will feel that the presence is there, but you can spot the few of them. But generally they are more Asian restaurants. So you find Japanese, Korean, Vietnamese, Malaysians, Chinese restaurants. A lot of them are around. Yeah.
So students who go over there, not too worried, you will still be able to have, some bites on Asian food. And char kway teow whenever you
yeah.
yeah.
But
yeah.
Do bear in mind that eating out can be expensive. Because eating out for a meal is like eating in KL. You get like $20 ramen and $30 pasta, but you are spending it in dollar and not in ringgit. But if you choose to purchase ingredients and cook by yourself, you can easily manage it within $100 to $150 per week with no problem, because Tasmania is a major agricultural production state. So a lot of the local produce are quite affordable and very fresh.
Yeah, thank you for sharing on that. Yeah. The other thing that I like to also clarify a little bit is about the honours program. Of course, there are some students who ask if the honours itself is an option, and if it's an option, when do they need to decide if they do it or not?
It's not an option, so all students will undertake honours. So it's what we call an AQF level 8 program, so Australian Quality Framework. So the 8 represents sort of a beginning of research training, essentially. So students will all work in a small group and undertake an honours project where you'll learn some basic research skills in an applied situation related to pharmacy in some way. So generally they'll be short clinical type projects, but all students need to do honours. So it's not an opt-in. Everyone needs to do it, because we need skilled graduates with those research skills to undertake research projects in practice.
Yeah, certainly. The Malaysia IMU program will have research portion as well, because it seems to be a sort of a core skills for all pharmacists.
Absolutely, yes.
How long would the duration be for the project itself?
The project itself is done in 1 semester, so generally about 12 weeks. And the group projects generally the once a week meeting with supervisors, working together as well in your groups. So it's compressed over a short time frame. The projects themselves are designed so they can be completed in that time, so we're not relying on external factors that could hold up things like ethics committees or patient recruitment, things like that. So they're very compressed, achievable projects in that semester time frame.
Yeah. The placement hours in Tasmania pharmacy program is very long as well, which is about over 400 hours.
Yes.
Yeah, and the students get to do it in hospitals, community.
All students will do it in a hospital. All students will do it in a community pharmacy, as well as the consultant pharmacy aged care training that they'll undertake. And they also experience a range of other areas like alcohol and drug services, and working with allied health teams, for example. So we have dentists and GPs and occupational therapists, the whole health sector. So you'll have exposure to that as well in the final year.
Yeah, so they get to move around to see different things.
Absolutely, yes.
Yeah, all right. The placement itself, is it arranged by the university?
Yes. Yeah. So we're not expecting, the students don't need to do anything. We will work with the student, our placement team. We've got a number of providers, placement sites, and they work closely with the student and the provider. It's very, very well organised process, and students will get placements and don't have to worry. And generally, you know, if there are other factors like travel, etc., we'll make it work for the student.
Yeah. So those of you who are listening, you know, you can see that there is extensive training on clinical placements as well in hospitals and community as well. So that will certainly be helpful in making sure that all the students are prepared to work. Yeah, perhaps we are about 4 minutes to the 9 o'clock. If you still have if any students have any questions, please just remember to put into Q&A. But perhaps last question from my side is basically, you know, how are the credit transfer students doing at the moment? You know,
they are doing
like
very, very well.
Share with.
All the students that have come through the credit transfer articulation have gone very well. We're a great cohort of students, well prepared for us, and the transition to pharmacy practice, they just fit in very well and achieve very well. So good graduates, great students, so doing very well.
Yeah, are they? I mean, are all the students, when they graduate, do they stay back and work there, or any idea?
It's hard to say. A lot of them I know are still working in Tasmania. As to the proportion, I wouldn't know, but a lot will stay in Tasmania. Some will move around interstate, etc., to the larger centres in Melbourne and Sydney, Brisbane. But a lot still work in Tasmania because they love the place, and it's a different lifestyle.
All right. Okay. Dinesh, do you have anything that you like to add on or find out or anything like that?
Well, I think this particular credit transfer pathway is a very, promising pathway. So I would say that it's really good. And based on how Prof. Glenn has explained the facts, I think it's a very worthy pathway which students can consider, especially in terms of employment or in terms of lifestyle and in terms of how Ray had actually highlighted about the food, what you get there. So in terms of all those things, I think it's a fantastic pathway for the students to explore and consider.
Yeah, any advice for students who are considering this pathway, Dinesh?
They are by IMU as well. So especially for all the credit transfer options, students need to score 3.5 CGPA. So as long as they have 3.5, they are already eligible to get into this particular pathway. So in the past, we have so many success stories of students who have got onto this part of this, and they will actually, potentially explore this pathway.
Yeah. All right. Anything else that Ray or Prof. Glenn want to advise students who are considering to go to Tasmania?
No, nothing further to add from me.
Nothing
Anything,
from me as
Ray?
well, except to encourage the student to give Tasmania a chance, because you won't find any place in the world to be like Tasmania.
All right. Okay. Thank
a
you
good way.
very, yeah.
In a good
Dr.
way.
Wong, hi, Tong here. There's a question in the chat box from, let me see, from, I think it's from Resty. He's asking, either he or she is asking, is there any program for PhD? I have master degree in community health.
Yes, we do have a PhD program for pharmacy students. We do offer PhDs within the school. Whether that aligns with his or her experience, I'm not sure. But there is obviously a requirement that it needs to be relevant for the discipline to undertake a PhD in the essentially the medication safety, drug sciences area.
Mm-hmm. Yeah, so perhaps the candidate who are interested perhaps can then visit the website and have a look, see whether you're eligible and write in accordingly. Yeah, and of course, IMU, we do have a PhD by research as well. And if you like to find out a little bit more from IMU website. Yeah, I think, all right, I think I'd like to thank all our speakers and of course, all those of you who are still with us. And I think I hope all of you have got some ideas, about Tasmania, about IMU, and of course, and hopefully all this information are useful for you to think about what you're going to do. And of course, if you need more information, please feel free to contact us at IMU. All right, we'll be able to give you a bit more information if you need of any. Yeah, so thank you very much, everyone. And we shall end the session here today. Thank you.
Thank you.